Why might the Buteyko method be helpful for people who are working in psychotherapy? Well, the answer is that a lot of your clients that are exhibiting anxiety, panic disorder, and agoraphobia have dysfunctional breathing. It's quite understudied, but reports suggest it can range as high as 75% of your clients. Now, how would you assess for dysfunctional breathing in your client population? Measure the control pause. So when you see your client coming in, have them sit down with normal breathing for a few minutes. Just allow their breathing to settle. And then ask them to take a normal breath in and out through their nose and pinch their nose. And time it in seconds, how long can they hold their breath for comfortably. So when they resume breathing, their breathing should be pretty normal. So it's not the maximum length of time you can hold your breath for. The rule of thumb is that if the control pause is above 25 seconds, there is an 89% chance that your breathing is functional. And that's from the work of Kyle Kiesel, a professor of physical therapy, who assessed the breathing patterns of 51 individuals across a number of different dimensions and concluded that your breath hold time, your control pause, that it provides good feedback of how well you breathe. So now coming back to your clients who are coming in with anxiety and panic disorder, you could argue that it's difficult situations which in turn change our breathing pattern. We breathe faster, we breathe harder, we breathe up our chest, we're feeling that we're not getting enough air. But that poor breathing pattern is going to feed back into the body's stress response. There's a number of mechanisms behind this. We have a structure in the brainstem, which is literally spying on our breathing. And if we breathe fast and hard, this structure will relay signals to other parts of the brain, and it can trigger anxiety and drive arousal and wake us from sleep. Another aspect is that when we have a habit of breathing harder and fast, we're more likely to have a stronger chemosensitivity to carbon dioxide. And there is a relationship between that and the autonomic nervous system. When the chemosensitivity of the body to carbon dioxide is too high, the autonomic nervous system can be in an increased stress response. And that can be feeding into our symptoms of anxiety and panic disorder. Another factor is that oftentimes when our breathing is fast and hard in our everyday breathing, and it's not that we're having a panic attack, it just means our breathing is that little bit faster and harder. The person feels that they're not getting enough air. And the feeling of air hunger, or they may call it suffocation, can also trigger stress levels. And very often they are terrified of the feeling of suffocation. So it can be very useful to give breathing exercises, and this is included in the Buteyko method, to help desensitize their reaction to suffocation. Another factor is, of course, if they're breathing high, this is more likely, of course, then to feed into a stress response. So it is very, very important to breathe low. The nose will generally improve the recruitment of the diaphragm, whereas mouth will more likely cause upper chest breathing. If you work with clients who have panic disorder, anxiety, racing mind, high stress, it's very important to improve the underlying breathing patterns. And psychotherapy, while an excellent modality, doesn't change respiratory physiology. If you look at the work of researcher Alicia Moret, she had 41 individuals with panic disorder and agoraphobia. She taught them cognitive behavioral therapy and slow breathing patterns. And she found there was a similar result whether these people learned cognitive behavioral therapy or slow breathing to normalize carbon dioxide. But the mechanism was different. So this begs the question, why not every person who is attending a psychotherapist, a psychologist, a psychiatrist, why not teach cognitive behavioral therapy, but also address their underlying dysfunctional breathing pattern? Because if the underlying dysfunctional breathing pattern is not addressed, there's more likely for those clients to have relapse down the road.